plane returns, it will have 2 Americans infected with the potentially deadly Ebola virus.
He's fighting for his life.
The special preparations that have made a local hospital ready to treat at least one of those patients. Good evening. I'm Justin Farmer.
I'm Jovita Moore. Within the next few days, one of the Americans infected with the Ebola virus will arrive here in Metro Atlanta and begin treatment at Emory University Hospital.
And Channel 2's Amy Napier-Bateri live outside the hospital in DeKalb County, where doctors will be treating that patient. Amy?
Tonight, Emory officials tell us there are plans to transfer a patient with the Ebola virus here to their facility within the next several days. They're not sure when that patient will arrive, but they say they will be treated in an isolation facility, one of only 4 like it in the entire country.
Late Thursday, we learned 2 Americans infected with the Ebola virus will be flown from Africa back to the United States. 1 patient will be coming to Emory University Hospital's Special Facility Containment Unit. According to Emory officials, the isolation unit was specially built with help from the Centers for Disease Control to keep patients in a high level of isolation, specifically those with serious infectious diseases. ABC's Dr. Richard Besser says it's possible isolated cases could appear in the U.S. because people can go 3 weeks without symptoms after infection.
But those cases would not spread it around the country. We have good hospitals and good infection control.
Sources told CNN the 2 Americans being evacuated are Dr. Kent Brantley and Nancy Wrightbull. Both are described as being in grave condition but are stable after their health worsened overnight. Both healthcare workers have been in Liberia with the faith-based charity Samaritan's Purse.
It's stable, but right now very serious condition. And Nancy is a little better. She was infected several days after he was.
Dad's visits with Mom right now are through window at the home where Mom is isolated, and he's in a containment suit even there.
Nancy Wrightbull is from North Carolina. Her son says despite the lack of a vaccine or known cure for the virus, the family is hopeful.
The Ebola virus, in terms of mortality rate, right now is at about 64%, and so that's good news for us. We feel like that's Mom has a chance.
Again, Emory officials have not revealed who the patient is that they will be treating here, but they say their physicians, nurses, and staff regularly train on protocols involved with treating a patient like this, and they say they are fully prepared to handle this case. We're live at Emory University Hospital. Amy Napier-Bateri, Channel 2 Action News, Night Beat.
Now, more details on the virus. Doctors say early symptoms of the virus include a sudden fever, muscle pain, headaches, and a sore throat. Symptoms can appear anywhere from days to weeks after infection. Ebola can only be confirmed through lab testing. It's only transmitted through contact with bodily fluids.